Hello, my name is Ravi Vij. I'm from My Cancer Haven. And today I have with me Dr. Nitya Nathwani, Associate Professor in the Division of Myeloma, Department of Hematology and Hematopoietic Stem Cell Transplantation at one of the premier institutions in the country, City of Hope. And we are going to talk about multiple myeloma and how he chooses between CAR-Ts and bispecifics. So welcome, Nitya.
Thank you. It's a pleasure to be here.
So Nitya, first of all, to set the stage, for those that are not as familiar with these different modalities of treatment, what's the difference between antibody, a bispecific, an antibody drug conjugate, a CAR-T, and then we can launch into what we have available commercially and how you use them.
Yeah, sounds good. I agree. So let me provide an overview of the different classes of immunotherapies because the terms can sometimes be confusing to patients. So among the different therapies, we think about conventional monoclonal antibodies in myeloma like daratumumab or isatuximab, which targets CD38, and elotuzumab, which targets SLAMF7. There are also, antibody drug conjugates, bispecific antibodies, and CAR T cells. So at some level, all of these depend on antibodies. So let me briefly explain what an antibody is. All mammals have the ability to create proteins called antibodies that can recognize particular biologic proteins. Our immune system can make antibodies against infections, and in the lab, we can now make antibodies for therapeutic purposes against any protein that we want. Fortunately, there are several proteins on the surface of myeloma cells that are not expressed by many other cells in the body or are expressed at low levels by other cells in the body. So we can use those molecules on the surface of myeloma cells as targets for antibody-based therapies. And in doing so, we use the immune system against those targets, hopefully sparing normal cells in the body. Now, there are many different agents that have been approved or in development with specific targets on the myeloma cells that these agents are directed against.